NCLEX Practice Test 2026 Ultimate National Council Licensure Examination Certification Exam. Question 1. A client is admitted with a diagnosis of heart failure. Which clinical finding should the nurse prioritize? Peripheral edema. Crackles heard on lung auscultation. Weight gain of 2 pounds. Fatigue. Crackles indicate pulmonary edema, fluid in lungs, which is a priority. ABC, airway, breathing, circulation, issue. Question 2. The nurse is caring for a client with a new prescription for warfarin. Which lab value is most important to monitor? Hemoglobin, INR, creatinine, potassium. International Normalized Ratio, INR, is used to monitor the effectiveness and safety of warfarin therapy. Question 3. A patient with type 1 diabetes is found unresponsive and clammy. What is the nurse's first action? Call the family. Administer 15 g of simple carbs if conscious, or glucagon/D50 if not. Check the patient's ID band. Document the finding. Hypoglycemia is a medical emergency. Immediate treatment to raise blood sugar is necessary. Question 4. What is the priority nursing intervention for a client experiencing an anaphylactic reaction? Obtain a detailed allergy history. Administer epinephrine. Start and 4-line. Apply cool compresses. Epinephrine is the first-line treatment for anaphylaxis to maintain airway and blood pressure. Question 5. A nurse is teaching a client about a low-sodium diet. Which food choice indicates understanding? Canned soup, frozen dinner, fresh grilled chicken with herbs, pickles. Fresh foods generally contain significantly less sodium than processed or canned alternatives. Question 6. Which position is best for a client immediately following a liver biopsy? High Fowler's. Left side lying. Right side lying. Supine. The client should lie on the right side to apply pressure to the biopsy site and prevent bleeding. Question 7. The 5 rights of medication administration include all of the following except: right patient, right room, right dose, right route. The 5 rights are: right patient, right medication, right dose, right route, and right time, and often right documentation. Question 8. A client has a potassium level of 6.2 milliequivalent/L. Which is the most important assessment? Bowel sounds, ECG/cardiac rhythm, skin turgor, pupillary reaction. Hyperkalemia can lead to life-threatening cardiac arrhythmias. Question 9. In the TNM cancer staging system, what does the N stand for? Node, lymph node involvement, neoplasm, necrosis, nature. TNM stands for tumor size, node involvement, and metastasis. Question 10. Which of the following is a symptom of left-sided heart failure? Distended neck veins, dyspnea and cough, ascites, hepatomegaly. Left-sided failure causes backup into the lungs, pulmonary symptoms. Question 11. A nurse is assessing a client with a suspected stroke. The acronym FAST stands for face, arms, speech, time. Feet, arms, sight, tongue. Fever, ache, shiver, tired. Find, act, send, treat. Fast helps identify symptoms and emphasizes the need for urgent response, time. Question 12. What is the primary purpose of a living will? To distribute property after death. To specify medical treatments a person wants or doesn't want in end-of-life situations. To name a person to make financial decisions. To provide for minor children. A living will focuses on medical preferences when a patient cannot communicate. Question 13. A client is receiving TPN, total parenteral nutrition. Which complication is the nurse most alert for? Dehydration, hyperglycemia, diarrhea, hypocalcemia. TPN has a very high glucose concentration, making hyperglycemia a common risk. Question 14. When performing suctioning on a client with a tracheostomy, the nurse should suction for no more than 5 seconds, 10 to 15 seconds, 30 seconds, 1 minute. Longer suctioning can cause hypoxia and vagal stimulation. Question 15. Which needle gauge is typically used for an intramuscular, IM, injection in an adult? 18G, 22G, 25G, 30G. 22 to 25 gauge is standard for IM injections depending on the medication viscosity. Question 16. A client is prescribed digoxin. Before administering, the nurse must check blood pressure, apical pulse for 1 full minute, temperature, respirations. Digoxin can slow the heart rate. It is typically held if the apical pulse is 60 bpm. Question 17. Which of the following is a positive sign of pregnancy? Amenorrhea, fetal heart tones heard by Doppler, morning sickness, positive home pregnancy test. Positive signs are definitive proof, fetal heart sounds, visualization on ultrasound, palpation of fetal movement by a clinician. Question 18. The rule of nines is used to estimate survival rate, percentage of total body surface area burned, blood loss, medication dosage. The rule of nines divides the body into sections of 9% to assess burn severity. Question 19. A client has a chest tube. If the tube becomes disconnected from the drainage system, what is the first action? Call the doctor. Clamp the tube. Submerge the end of the tube in sterile water. Tape the end closed. Placing the end in water creates a temporary water seal to prevent air from entering the pleural space. Question 20. What is the therapeutic range for lithium? 0.1 to 0.5 milliequivalent/L, 0.6 to 1.2 milliequivalent/L, 2.0 to 3.0 milliequivalent/L, 5.0 to 10.0 milliequivalent/L. Lithium has a narrow therapeutic window, typically 0.6 to 1.2 milliequivalent/L.